causes women react in everyone reacts differently, and even you're finding at different times you can react differently.
But it's kind of been consistent. Like I've been like, sometimes I just have these cries when we were like on Christmas break and stuff. I just was like crying every day. I was just like so sad, and I would just like find myself like driving my car to go somewhere because I'm like, I'm so sad. I don't know what to do.
So you have to be really careful because during pregnancy depression increases the risk of the postpartum depression. Did you have postpartum last time?
I didn't think so, but like looking back, I definitely did, and I should have seen somebody.
Okay, and so that increases the risk this time too. They haven't had that, and it's highly treatable. So treatable. It's one of the most treatable conditions. So
How do you treat it?
It's medication because it's so biological.
Because last time you were talking to me about that, but I didn't think it was like something you could like take a pill for.
Oh yeah. 100%.
And it's been around for a while?
I would say that the treatment of it has been vastly improved since, say, when I was running at a psychiatric hospital. And there's two things that can happen after pregnancy, right? You can get postpartum psychosis, which is the one where women put their kids in the bathroom and kill them and stuff. The psychoses are profound. Or the depressions, which are also profound, and they're strictly biological. They're 100% biological. I mean, obviously, with everything in our biology, there could be some psychological elements in there, but this is a biological process. And it has a biological solution, and we're very good at treating that now. I mean, very good. So don't not access that if you need it.
Yeah, I know a lot of the people that watch, they like related to this too, is like, you're scared to tell, when you go for your checkup for, after you give birth, they ask you like, are you okay? But you don't want to check no, because last time I checked, no, I wasn't okay. I wound up in like a mental hospital. You know what I mean? So it's like one of those scary things to be like, I'm not really doing great. What are they going to do with that information?
Let's kind of parse that apart a little bit. So you're fearful somebody's going to put you in inpatient, right?
Yeah, like what if you say the wrong thing? Like,
right. So the wrong thing. Everything keeps people out of the hospital. They will. You have to be extremely in trouble for them to put you in a hospital these days. Okay, so I'm going to hurt myself, and I have a plan, and I have nowhere to live and nowhere to eat. Other than that, or I'm going to kill somebody. Yeah. Other than that, you're fine.
Okay.
You can say I can't function. I can't get out of bed. I'm really sad. I feel guilty. I'm worthless. Blah 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 blah.
Yeah.
That's all. No problem. We can treat that.
Okay, because that's what I know. So many other people are like, I'm kind of scared to like put anything because it's like. Don't know what's going to happen.
Well, hey, listen, it doesn't have to be, another way to deal with this is that's your obstetrician doing that, right? The OB doctor?
Yeah.
Yeah, just tell them, I think I need to talk to a psychiatrist. Don't even tell them anything. Except I just want to get an assessment. Psychiatrists are so used to dealing with this and they're so good at it, it won't be any kind of like funny business. OB, they get nervous because it's not their field.
Right.
So just if you feel like you need help, just ask. Look, I've been thinking about this a lot lately, which is that we live in a time where people are not getting treatment for brain conditions, right? Biological conditions, because of a bias that was created around psychiatric care from first like medieval times, where if you're possessed or there's something wrong with your brain, there's something wrong with you. Then more recently, I don't know if you're aware of this history, in like the 1960s, there was an author named Ken Kesey, wrote a book called One Flew Over the Cuckoo's Nest. Then there was a movie. That movie affected people like they were watching a documentary. They were not watching a documentary. They were watching a fictionalized hospital from the 50s. So literally, people are still biased from a story that was 75, coming in on 100 years ago.
No accuracy to it?
No relationship to medical care of the current age.
I haven't seen it. It sounds triggering.
It would be.
Yeah.
But it's actually a really good film. But that's not done like that anymore. It's all medicine. It's just anything that if you went for your appendix, it'd be different than in 1930. It's you know what I mean? It's not how it's done. And by the way, probably one of the fields that advanced the most in that 75 years is psychiatry. And environments where people get treated are usually lovely. So psychiatric hospitals are not like that.
Yeah, psychiatric hospitals are like, I have trauma from them. So that's why I'm always like, I don't want to go back. And I honestly like don't remember ever saying I like wanted to hurt myself.
Well, when was it? How long ago?
2019. 3 times.
So 2019, it was 5 years ago. It's gotten better even since then.
Really?
So yeah, but they can. It depends where you go, right?
Alhambra was mine.
Oh yeah, we got yeah.
They wouldn't let me out.
Yeah, it's a lot of cement there.
Yeah, just like walls, and they don't let you go to the cafeteria, and like
Yeah.
it's like really crazy. You like can't leave at all.
And also the really the liability that I find. There's some nice areas in that hospital. There's some common spaces. That are
I was
nice.
just in down one brick hallway. That was the only one.
By the way, I worked there too for a long time.
You did?
I worked all these places.
There was like an ED unit right next to it, and then there was like us, like one hallway, and it was co-ed, so it was just like boys and girls, which was like
with the nursing station right in the middle there.
Yes.
Yeah.
Mm-hmm.
That's it's okay. I mean, it's nice, but now these days the big liability of the big unpleasant part of these facilities is the people that do get in are so sick. And so low functioning that it's kind of uncomfortable to be around people.
I think that's what it was. And I was like,
Yeah.
as soon as I was like kind of like sobered up, I kind of was like, I want to be out of here. And they were just very much like,
Do you have a relationship with that psychiatrist anymore?
no.
So you have a psychologist now, right?
Yes. And they gave us pills in that place. And like no
I know.
one really evaluated me to like give me pills. And they made you take them at like 5:30 in the morning. Which I was like,
I know how it works.
I was like, what is this? What am I putting in?
I worked there for a long time. I know how it works.
What is it? Is it like a sedative or something? Like, because I know they gave me a sedative when I went there. They like stuck something in my thigh to strap me down, and then when I got there, they kept giving me like pills in the morning.
That was probably Ativan that they put in.
Ativan, that's what it was.
Yeah, and
no one asked.
Not an emergency. It's considered an emergency.
I just was running. I wasn't like attacking anybody.
I'm on your side.
I was just running.
To me, the odd thing is that they take a Trisha Paytas down, and yet somebody who's dying in the street they won't go near. It's like
that is crazy, right?
That is crazy.
Yeah, that's wild to me. Yeah. So I have a little issues. I mean, it probably helps a lot of people, but not me.
But you are seeing a psychologist, right?
Not.
But you have a psychologist.
Yes.
So that's
I
the
do.
person you can turn to help you assess whether you need or not need, and they would have somebody to
But
refer.
like postpartum, he's a gay guy. I don't think like postpartum he's gonna like. Maybe he knows. I don't know.
He'd be fine.
Really? I don't know. I feel like you should see a specialist because like
you will, but he would be able to assess your need for that and then who you should talk to. So you want to be somebody you can really trust because you don't want to go through all that again.
But one thing I learned postpartum last time, I think you talked about this last time you were here. I was very anti-men, and I was like. After my birth, I was just anti-men, gay men, straight men, any men, because I just felt like they didn't understand, like my hairstylist and stuff like that. They just would like not understand like what I was going through. I'd have like a complete like breakdown during our Christmas card photo shoot, and they took it like personally. And so I was just like, men don't get it. So I was kind of like, that's kind of when I like distanced myself a little bit from my therapist because I was just like, you don't get me, you know what I mean? So I think going back would just be hard.
What about seeing a female therapist?
I guess just finding the right one. I guess
it's hard.
Yeah,
it's hard.
It's hard to find somebody.
But your statement that men don't get it could not be more accurate.
Okay, so I'm not like delusional.
No, as usual, your stuff is intense, but has a foundation in truth.
Yeah,
right.
Right.
I mean, that's what we've always talked about.
Yeah.
You just have trouble expressing it or finding how to tell other people about it and stuff. But as we are very, very different as males, we just are.
But you get it. You're the only one that gets it.
I'm not the only one. I had to have years of therapy. I think I've told you that, right?
Yes.
And I get it because I had a female therapist who attuned to me deeply. And when you're the object of that attunement for long periods of time, you start to, first of all, understand what's happening. You start to get the attuned, which is really important for babies, by the way, which I think you're getting. I'm seeing that you're getting a lot better at.
Yeah. Mm-hmm.
You know what I'm talking about? Attunement, like be able to hang in with emotions and be present. It's hard with babies. They challenge all that.
I know. That's been difficult for me for sure. And that's why I always talk about like not feeling naturally maternal.
Yeah.
Because it's like hard for me to like tune into that. And when
and
she
is that
like
because it's evocative or spins you at all? Or
spins me. Yeah, that's
which is normal. I mean, everybody gets babies. That's how they get their way. They spin you.
Yeah. I was like, I don't know what to do. And just.
Right. Well, try to take a beat and listen because you do have good instincts. You just have to hear them.
Yeah.
Right?
Yeah.
Can you help her do that? Because she needs support to be able to do that.
He does. He's so great with it. Like, I never once cry in front of her, like, lose my cool, like, nothing. I can, like, remove myself because he's always here. But I feel for the moms that don't always have, like, a partner with them because if I was, like, alone doing this, oh, my God, I'd be like.
Yeah. So I was the object of that kind of attunement. I started realizing, oh, my goodness, I've changed how I relate to my patients and my boundaries are better and I can really – I was such a codependent. I have trouble distinguishing between somebody else's feelings and mine, which is a hard thing. You get that?
Yeah, of course. I'm so codependent.
Yeah. And so what I thought were my feelings being evoked by the other person were really just the other person's feelings.
Oh, interesting.
And so that's what can happen. And your stuff can definitely go into that zone pretty easily. So you have to kind of learn how to keep that boundary straight. And it's a very rich place to live where you can feel other people's feelings and know that they're theirs. So codependency has not just liability, also has assets because you're attuned. You're in with other. I mean, you're like me in that you go out and then in, right? You experience other people, then you experience yourself. Some people are wired the other way, where they experience themselves and then they go reach out to. I know it seems odd.
What is that? That's like projecting or something?
Well, no. You can. Our type can also project. But Bob Forrest, one that told me that, he goes, I think there's two kind of people in the world: people that go in and then out, and people that go out and then in. I thought, I think you're right, Bob. You definitely go in and then out, Bob. And he goes,
we love him. Where's he at? We need him on the podcast.
You get him a second. I mean,
is he around still?
Oh yeah.
I love
my
him.
goodness,
Okay.
he's very. Both he and Shelley have had long careers, and Shelley is like, you stuck to her.
Yeah, I loved her on the show too because they did the House after, right? They did Sober House.
Yes, they did all that. But Shelley now has run program. She got another degree. She's like amazing.
Oh my gosh,
amazing. And she was a bad heroin addict. Oh my God.
Really? Heroin's so intense. When you said both of them did heroin, I'm like, that's so intense.
It is intense, but
oh my gosh. Like that's like you have to like wrap it up and shoot it out. It's like so much.
It's so much.
Wow.
And now fentanyl is what they're going for, and fentanyl's killing everybody in good times.
Yeah.
So now everybody's fentanyl meth, which is a terrible combo.
But fentanyl's in everything now, right? I'd be scared to do drugs anymore because it's like literally
it's in everything. Your audience would be good to be warned about this. So let me make a warning.
Yes, please.
Which is that every time you buy something that you don't know where it came from or you didn't get a prescription for it didn't come from a pharmacy, literally every time, no matter what the substance is, it could be laced with fentanyl and it could be laced with enough to kill you with a single dose. It's happening a lot. That's the growth. I think everyone's aware that people are accidentally overdosing on fentanyl, that they seek, that you're going to get fentanyl, or the fentanyl gets mixed in with the heroin and you don't judge the dose properly. Accident. But the group that is accelerating most rapidly in terms of numbers of deaths, it's young people just screwing around with meds. And they just get their hands on something, they think it's a Xanax, dead.
Xanax too?
It's in it's in everything.
Wait, what? Really?
It's in Xanax, it's in cocaine, it's in cannabis, it's in everything.
Whoa.
Yeah.
Oh my God, I did not know that. I always thought it was like Coke or something like it was.
It's in everything. They're putting it in everything to, I don't know what. I don't know what they think they're doing. I guess give them more high, get them more hooked or whatever.
Is it cheaper or something? Is that why they're doing it? They're making
it must be cheaper, for sure cheaper, and somehow more satisfying, I guess. So they think it's going to be more satisfying.
Where
but
does
they
it
put
come
just
from?
a little bit